Welcome to the Living Well podcast, hosted by City Union Mission. In each episode, we bring you inspiring stories of transformation and insights from those who've overcome life's challenges. Join us on this journey of resilience and discovery. Let's dive in.
Hello and welcome to the Living Well podcast. I'm guest host Brad Burrow, and today we have Philip Garvin, who's the clinical director at City Union Mission, counselors, all of that, and we'll let you dive into that a little bit more. And Danae Chichester, who's the health services coordinator and supervisor. And I need to take a breath after that title, so catch my breath here. But thank you guys for being on the podcast. I really appreciate it. So we want to kind of get into more of a 30,000 foot view of what you guys do at City Union Mission. By the way, there's other podcasts out there where we've talked individually, so you need to go back and check those podcasts. You're going to learn something like I do every time. So there's a lot of really good information. But Phil, maybe start by telling us, tell me about the team at City Union Mission.
The clinical team?
Mm-hmm, yeah.
Okay, so we have a team of counselors who work both in our shelters and our recovery programs. I oversee that team. And then we have the health services team. Danae's the lead of that team. And then the L minor team, which is our ministry for persons who have very high barriers to care. So that's the team. So we have the three parts of it, the counselors, the health services, and the L minor team.
And tell me a little bit more about L minor. That's something we've talked about in some previous podcasts a little bit. What happens there?
So that was a ministry that developed to meet the needs of persons who had either chronic homelessness or had some significant barriers to care, like some mental health needs or some physical health needs that caused them to be particularly vulnerable when they were in the shelter with the big group of persons. And so we actually do an assessment of their needs and then move them into a place where there is a higher staff ratio, where the culture is very calm and soothing, and there's not a lot of extemporaneous demands placed on those persons. So we really work with them until we can locate a placement that is permanent and safe. And so that really is the L minor care ministry.
That's pretty hard to do, probably, right? Finding a placement for folks with those types of needs.
We have a team, especially led by the administrator, Amanda. She's outstanding at finding places, and this really comes through her years of working with agencies and building collaborative relationships.
Yeah. So
she's really, really good at that.
Yeah. Yeah. What would you say to that? Talk about your team.
Yeah, so the health service team, we actually interact with all of the other teams and divisions in the
It's like
in
spaghetti.
the
It's all comes.
We're everywhere. We're everywhere. I get the privilege of working both at the emergency side on the men's center side, and I get to move across the street when our guys go to program. So the health services encompasses all, like from the beginning to the end of leaving the mission. And the family center is similar. So on where our women's ministries go, I have my nurse Sherry over there. She sees the guests when they come in, and she gets to see them still when they're in their recovery program over there. And then I also get to work closely with Amanda at L Minor Care, and I get to refer people to her and then work with them on their needs. And we work very closely together. Amanda and I do throughout all week. So we also work with hospital referrals and hospitals in general, requesting information and figuring out, is this person beyond our care, or is this someone we can address and help?
So do you guys meet and like talk about strategy and talking like a business person here, but here's this person, here's the issues we're seeing. How can we support this person? Do you talk as a team about?
Oh, absolutely.
Yeah.
That's one of the strongest things that we do is get the whole treatment team around a person. We call it their supportive community.
Yeah.
So when we're working with an individual and we're seeing some things, Danae will be on that team. I will be on that team, the counselor, the case manager, and just looking at the person from all the different perspectives. So yeah, definitely.
Mm-hmm.
How long does the assessment process take? Like somebody comes in, and how long is it before you actually kind of have a plan together and how we're moving forward?
Oh, that's person oriented. So each case is
Different for
completely
everybody.
different. Absolutely. Especially because if we have an individual that comes in and they have substance use in their history and maybe they're having to work through getting that out of their system, that automatically delays things because we know even though their behavior may be showing something from substance use, that's probably not them as a person. We need to wait until that dies down a little bit, then we can assess, okay, where's their baseline? What do they actually need from us? If someone who is an alcoholic comes in, we need to medically make sure they're safe to stay and they're out of the withdrawal window before we can do anything else. So that right there might slow things down, but it's really person by person.
And so you take people in those situations that come in those situations?
Yeah, I mean, if they're as long as they're out of the window for a medical emergency risk, then we absolutely work with them in any addiction and working through to try and help stabilize them.
Yeah, Brad, you were asking about assessment.
Yeah.
Early on, it's heavy in gathering information, but it never does really cease to exist. It's ongoing. We're always taking in what we're seeing with a person and giving them feedback, and it individualized, and they are giving us information about how they're responding, how they're growing, what they need. We involve them in the recovery process. We ask them, what are your goals? What do you want to accomplish? How can we help you accomplish what you want? So assessment is heavy on the front side, but it continues throughout.
What's a typical goal that somebody would tell you in that situation? So you ask them what their goal is. Is it, I want a new life. I want to get a job. What's typically, what do you hear?
Yeah, that is definitely sometimes they'll say, I want to overcome my anger. I want to heal from my past. I want to be stable. I want to find a place to live. I want a job that has a sense of meaning for me. So those are some of the common things that someone would have as their goals.
Yeah. Do you hear that too?
I hear those same things. On the medical side, I also end up hearing things like, well, I can't afford my medications.
Yeah.
I need medications, or I haven't been to the doctor, but I have kidney failure, so I need to get back into the doctor, or, things like that too.
What happens when a homeless person that needs medication, I mean, they have no way to get medicine?
There's a lot of resources in Kansas City area that we can work with.
Really?
Yeah, absolutely. The primary provider we work with is SWOPE for that, because they have an outreach service that actually ministers to homeless. Now, they're not a Christian organization, so it's focused on the physical needs, but that works for us because we need the physical needs met in that regard. So we partner with them closely in that regard. We send people their way, and they can help provide the medications. There's other resources in the Kansas City area as well that provide either free or discounted medications, and of course, getting them plugged into a primary provider. That's key for that continuation of care.
So that's possible.
Mm-hmm.
Yeah. So Brad, I had a really cool thought about when you asked that question. Our ministry is really to help a person get out of the cycle of homelessness. We're trying to help people become permanently housed and resilient in the community. So a lot of our ministry is helping make that connection. When someone needs medications, there's a barrier there, and our job is to say, look, these are the resources that are in the community. Let's access those so that your health recovery, your physical health is well, that you can be stable, so that you can function, you can be resilient.
Yeah.
So that's a lot of what we do, is help someone learn the skills that they're going to need so they can be resilient beyond care with the mission.
Yeah, that's amazing. Well, you kind of just answered this question, but the goals for the clinical team for City Union Mission, what are those goals?
We have a vision statement.
Okay.
We dream of a day as a clinical team. We dream of a day when every interaction and every intervention at the mission is be biblically integrated. So we want to take the truths of Scripture and the truths of anything that's helpful from behavioral health science that doesn't contradict with Scripture. We want to integrate those to benefit the person. The letter E, we have a best bet. The letter E is for evidence-based. We make sure that all of the interventions that we do are based on scientifically verifiable, that they are helpful to someone who experiences trauma. So in counseling, at least, we choose services or treatment modalities that are based on evidence. And then lastly, the T of the best bet is trauma informed. And so we have a high awareness of how trauma affects a person. And then we move everything to be in alignment with like a trauma informed care approach.
By the way, we understand what trauma informed is because we talked about that on another podcast. So go back and listen to that podcast if you don't know what that means. Okay.
Yeah.
Do you want to jump in on that one?
I just want to say that was one of the reasons I wanted to work here
Yeah.
when I actually heard the
Yeah.
best bet, because on the medical side of things, we want to always be evidence-based. We always want to be trauma-informed. But by understanding that we're choosing to biblically integrate everything, that we're also seeking the spiritual side at its core, because as we've also previously talked about, a person isn't whole without that spiritual side as well.
Yeah. Which leads me to my next question. What sets City Union Mission apart from other recovery programs? And you hit on it.
Yeah.
But what do I'd love to get a response from both of you.
Well, we have a whole health approach, and there are really 6 areas that we've identified. There's the mental, the thinking area, the emotional, the physical, the social, the vocational, and most importantly, the spiritual area. If you made a circle, you could have 6 pie pieces.
Okay.
We try to address whole health recovery. We're trying to recover God's design for the person and getting those things back, restoring those things. We believe that a person is going to be able to be resilient. And when I've talked to other programs, they don't emphasize the whole health part.
Yeah, I think that's what I see as well. Is there's a tendency to balance one way or the other. So especially in Christian ministries, there's a tendency to focus on the biblical foundation and the spiritual side of things. But Scripture tells us, what good is it if you say go in peace and be filled, but don't give them what they need? That doesn't do any good either. So we're wanting to fill their spiritual needs, but also physical. And on the flip side, we see other places that are focusing on only the physical side, and we're seeing that evidence base in that direction, but not including the spiritual. So something that we do differently is all of it. We include all of it, and we do our best having licensed counselors and registered nurses. We're not having people that don't know what they're doing. We're actually choosing experts and putting them in the place that they can help fill that need altogether.
Do you guys, so this is a question that popped into my head, from a faith standpoint. Do you think it's possible to meet a spiritual need before meeting a physical need? I think
it's definitely possible.
Excuse me.
But I want to be open to a willingness to meet a physical need, to lay the groundwork. When I think about what we do, I think a lot about Jesus' parable of the sower.
Yes.
He said a sower went out and he threw the seed, and we know that he explained that the seed is the gospel message, and it fell on different kinds of soil. There was good soil that produce a fruit, but then there was a ground that had stones, and there was a ground that had thorns, and then there was a seed that went out into the pathway. And so when I think about meeting physical needs and meeting emotional needs, the seed itself didn't lack efficacy. It was the ground that it landed in. And so helping someone overcome trauma is like taking the stones out of the ground and tilling it to make it healthy soil so that the gospel message can penetrate and start to produce life. And so I am willing, as a practitioner, as a clinician, as a minister of the gospel, to be sensitive to what the Holy Spirit is leading me to do, to be ready to share the gospel, but also be ready to follow the example of Jesus and provide bread, or provide a point of healing, or a point of contact, or a safe relationship, so that the gospel can find good ground in the life of the person.
Yeah. I think to pivot off of that, in the physical realm, we have physical needs, and the Lord created our bodies to do certain things. So when we have trauma occur, our bodies respond certain ways physiologically. Like, we have actual physical responses, and that's proved. It's not like it's just, we just feel this way. No, our heart rate increases if we're in a traumatic situation, and our blood pressure goes up, and blood literally moves from certain parts of our body to other parts of our body as a survival mechanism. There's a whole lot of scientific thing we could get into, but ultimately your body shuts down the managing part, so your restfulness and your ability to digest food, and it goes to instead triggering a lot of hormone release, I guess is the best way to say it, that triggers responses, which means you're ready to run, or you're ready to defend yourself, or you are focused only on those physical needs. So there are people that arrive at the mission that are ready, that are receptive in that moment, and they are needing the spiritual side right that second, and that's what they need. And there are a lot of people that are not ready for that because they're hungry, or they're tired, or they've been unsafe, or if they're coming from a dangerous background or fighting for their lives, stayed awake for days on end because of safety issues, things like that, they're not ready to hear spiritual because they got to sleep, or they need food in their belly, or they're thirsty, or they have an infection that's raging and they need that care too. So I think that's where the assessment piece comes in. I think understanding what each person needs as they walk through that door is key to understanding, are they ready for spiritual first, or do they need that physical along with the spiritual?
Yeah, that's great.
You know, Brad, some of the folks that come to find shelter at our shelters and recovery program, they also have a lot of religious hurt. Where persons in their past have inflicted trauma in the name of religion or in the name of God. And so sometimes, you know, in another podcast, I talked to you about how someone is a victim of trauma. They're drawn back to those traumatic experiences. Sometimes I think that someone who's anti-Christian message ends up in our program because they're trying to resolve something. And so that love, that patience, that meeting other needs in their life as we are consistent, demonstrating the love of Christ, being a safe person in their life. I really think that lays the foundation for healing from previous religious trauma, so that the true message of God's love and that a new life is available, that they can come through our lives.
Yeah. Building that trust takes time, doesn't it? It's
It
not
does.
just one meeting.
Definitely when someone's had a lot of painful experiences, because trauma is about being helpless and being overcome by a power differential. So, yeah, it does take time.
Yeah, yeah. Do you have anything on that one?
I agree.
No, you're doing great, So this seems like a very obvious question to me, and we've talked a lot about on the previous podcasts about trauma, but why is it an important thing to address? I mean, you can't heal without getting that addressed, correct?
I mean, trauma, as I think I mentioned in our previous podcast, trauma is coming from homelessness. Homelessness is trauma. So, I mean, there are so many traumas that can occur just by being homeless, and that can lead to homelessness, which then perpetuates the cycle. So without addressing trauma, we're not addressing the root. And if we're trying to end the cycle that people are stuck in with homelessness, we've got to address the trauma. That's just the root of it all. And if we respond in ways that are not trauma informed, and we're not addressing the trauma, then we add to it. So like church hurt.
Yeah.
If we continue the message from people that they're receiving that Christians are judgmental, or Christians aren't going to actually help them, they're just going to pray for them instead of meet their need, or they're going to say no, or fill in the blank, whatever it is that they've heard from the church. If we perpetuate that, that continues the trauma and doesn't actually help. If anything, it pushes them away. So addressing that trauma is key. It's at its base.
Yeah.
I think of some words, they're not very scientific, but they capture the meaning. Stuck in a rut.
Yeah.
So someone who's been traumatized is really stuck in the rut of not being able to move forward. There's an unfinished part of a task that they're trying to resolve. And so we have to address trauma, because all the other areas of life, they're not able to keep a job, because when they get re-triggered, then these explosive, angry outbursts come out. So we try to address those things so that a person can heal and move forward.
Yeah, yeah. Do you train your staff to? I mean, it feels like if somebody was working there, that they would need to understand how to kind of recognize flags, red flags, or here's an area that I see. Are you guys trained? I mean, I know you guys are, but like the staff, the frontline people especially, to say this person's dealing with this.
Absolutely. It's an ongoing process.
Always.
So one of the things that we face is a phenomenon called secondary trauma or vicarious trauma. That is when a person who works with someone who has been the victim of trauma, we carry that into ourselves, our ability to empathize and understand and care about that trauma. It comes over into our lives as helpers. And so it is a phenomenon that we have to address all the time to cleanse ourselves of that secondary vicarious trauma. So it actually falls into my purview to have a strategy to help all of our frontline staff. And so just recently I began implementing a strategy to make sure that we're fully trained, that we are fully resilient against the dangers of vicarious trauma.
Yeah.
And it takes constant reminders sometimes. So there are times that, in those table meetings when our whole team is there and we're interacting together, sometimes it takes like, well, I'm seeing this pattern, or this is something I'm recognizing. Is it possible this is what's causing that? Or can we think about that? Do we know if there's triggers like this in their past? Sometimes it's as simple as, I use this example because it's pretty direct. One of our participants came in and he was struggling turning in things, like papers or handing over things to his case manager. Very simple, like seems like an easy task to hand it over. But he had been out of control in a hospital where he had everything taken away from him for his safety. And so in the program, that was a trigger for him. So he would get angry. He would have outbursts. He would just really rebel against the idea of turning in a piece of paper, just handing it over to his case manager. And once we realized his history, well, he was literally in a hospital and everything had been taken away from him. That's a trauma for him that triggers when he's handing in a piece of paper, changed everything. So there are little things like that the collaborative team can identify together. And sometimes it's the reminder of just, hey, is it possible this is what's causing that outburst? And it's not just a failure to control. It's actually we are triggering him. So can we address that?
And your team, you must have an incredible team to be able to sit down together and, dig into a potential problem and recognize it.
Definitely. If you're talking about just working with someone in their recovery, it is an awesome privilege and responsibility to work with someone as they're trying to gain back the skills to be resilient in life. It's an awesome privilege. And then the team that we have is just amazing. God has assembled such a talented, passionate bunch of people who want to see folks grow in their faith and become resilient.
And I feel like everybody that is involved that I've talked to, every person says I was called here. Would you agree with that?
Without a doubt, for me,
it's God's team.
Sure.
Yeah, I think so.
Yeah, initially, like I told you, I was a little bit resistant to coming. I really didn't understand what God was going to do just in my life. I've grown so much just in 3 years that I've been at the mission. The Lord has just done amazing things in my life. So I am definitely called to be at the mission.
Yeah. Danae, you as well, right?
Oh, absolutely. Yeah, same, a little hesitant to come, but mostly just because I loved what I was doing before. And then when I realized that it connected with this and the Lord was preparing me for this, I mean, if it really came down to it, that opened my eye to see, okay, what is it the Lord can do? And he's done a lot since I've been at the mission. It's been a lot to do, a lot to see. And I've changed for it too. So,
yeah. So I want to kind of wrap up here. So one of the questions was trauma-informed care, which we talked about on the previous podcast, so go check that out. But I think about graduation day at CLP, and we've done some videos and different things. Do you guys all participate in graduation day?
Yeah, we do. The band that we were talking about earlier were musicians.
Yeah.
We do the worship at the graduation, but it is a huge celebration of all the hard work that a person puts in to their own life, recovering God's plan for their life. It's pretty exciting.
Absolutely.
Yeah. How does that feel? That's got to be, I mean, because everybody's, in some way helping the people that have graduated the program.
Oh man, it's amazing. The first graduation I was part of, I'd only worked for the mission for a couple months. And so I got to see kind of on the front end a little bit, the back end. Like and at the very beginning of my time at the mission, I got to see what it's like at the end. And that was really cool because then I get to work toward that. I get the privilege of working with the guys when they arrive at the mission and seeing them through the program. And then I get to see them at graduation, which is not true of everyone in their position because they start out in the emergency shelter. They don't start out in the program, and they end in the program if they decide to go that route, which means I get that privilege of seeing both sides. And it is exhilarating to see how the Lord works at the mission.
Yeah, I bet so.
It's a lot of
all
hard
worthwhile, right?
It does. It's a lot of hard work to get to that point of graduation for sure.
Absolutely.
So the last thing, I know we've talked about this individually, but what can somebody do to help support your mission in what you're doing? We'd love to have volunteers. What do you think?
Definitely can pray for us. The work that we do is really hard. A lot of times we struggle with the heaviness of the recovery work.
Yes.
And a lot of times participants, they're not successful in making it through. And so we bear that burden. And so praying for us, it's a spiritual battle.
Yeah.
There are forces of good and evil that are in war in our buildings every day. Definitely becoming a volunteer where they mentor someone who's in recovery, or we definitely need tutors right now. There are guys that are working on, and women who are working on achieving their high school equivalency.
Yeah.
And so we need English tutors and social studies tutors and chemistry tutors. We need mentors. We need godly people to take our participants out, to get them away from the center and maybe go to a ball game or maybe go to a museum or go to a concert. So we need that. We need folks to contribute, to believe in what we're doing, and to contribute financially. So those are some of the things I can think of right off the top of my head.
And that would all be through the website that somebody would connect?
Definitely so.
Basically go to the website.
Yeah.
cityunionmission.org.
Yep.
And or info@cityunionmission.org.
Yep, you can email that.
So,
Absolutely.
yeah.
And I would add to, we need community partners. So, and that can include an organization, and that can include just a person, an individual, a family. We'll do tours. We'll show you around. We'll let you see what we're doing. And then once you are able to see it, typically people come and they're like, I did not realize this is what it looked like. I didn't realize this is what you're doing. They see our program recovery building. They realize, wow, you guys have like this all set up into a little community over here. Yeah, we do. Like that's what it's for. And the men's shelter isn't just a huge open room with a bunch of beds and no resources. Like we have resources there. We're constantly interacting with our guys, and it's really awesome to see that. Once you've seen it, you can tell other people about it and then spread that information. And that's a community partner too, if you're just able to talk about us positively.
Right.
Yeah.
Well, thank you guys for being on the podcast. I really appreciate it. It's been fun morning.
Yeah.
Learning a lot. So thank you for joining us on the podcast. Please share this content, forward it to somebody that really can help, comment, like, all those things. Tell people about City Union Mission and what they're doing. It's amazing. You need to get behind it. We want you to support it. We've got big plans for the future to do big things. And we can't do it without you. So thanks for joining us, and we'll see you on the next podcast.
Thanks for tuning into The Living Well. Be sure to subscribe on YouTube, Spotify, or Apple Podcasts. Follow us on social media for even more inspiration. Want to join our mission? Visit cityunionmission.org. Stay inspired, and we'll catch you next time.